This is Robert Kraft, and I'm coming to you live on SNNLive, and we're here at the SeeThruEquity and the Brewer Group's second annual Innovations Investor Conference 2016 in Miami, Florida. With me right now is Dr. Bill Stern from NanoVibronix. The symbol is NAOV. Dr. Stern, welcome to SNNLive.
Thank you very much.
It's great.
Great to be here.
Oh, it's great to have you.
Thank you.
So, for our audience, let's get an overview of the company.
Okay, so NanoVibronix makes ultrasound devices for relief of pain, infection, wound care, facial rejuvenation, and a couple of other applications. The distinction of NanoVibronix from other companies which use ultrasound for pain management, for example, is that it's wearable ultrasound. Ultrasound, traditionally used for pain management, is applied in a physical therapy, a physician's office. It's applied for a period of 15 to 30 minutes. It makes the patient feel very good and relieves the pain, but as soon as the patient walks out of the office, or within a few days, the pain comes back. We distinguish ourselves because we have a device which works a little differently with ultrasound. Instead of ultrasound going through the body completely like classical ultrasound does, like an imaging ultrasound or in therapeutic ultrasound, our device is called surface acoustic wave ultrasound. What that means in layman's terms is the ultrasound enters the skin, and as soon as it goes into the body, it makes a right turn, and in a radius of about a couple of inches, it irradiates whatever is there. And what we do is we put the ultrasound where the pain is. The pain is caused usually by a defect in the myelin coating of the nerve. Our ultrasound tends to heal the myelin coating, thus not only giving relief from the pain, but also affecting a semi-permanent or permanent cure from the pain. The pain doesn't come back in many cases. Okay. So that's one product we have. We have a number of other products. The other product we have is called, that product is called Pain Shield. The other product we have is called UroShield. UroShield also uses surface acoustic wave ultrasound, and it addresses the problem of urinary catheters, infection in urinary catheters. Catheters which are inserted for more than 6 or 7 days and even sooner become infected with bacteria which form on the surface of the catheter and pass this infection on to the body and create serious problems in maintaining catheterization for long periods of time. Our device clips on the end of the catheter. It's the same actually ultrasound driver, but it vibrates the catheter at the ultrasound frequency that in this case is 96,000 times a second, and prevents the colonies of bacteria from clinging to the catheter, thus preventing infection. It also reduces the pain and the being uncomfortable with the catheter. The third product we have is called Wound Shield. That product was called UroShield. Wound Shield is a similar product, which is an ultrasound product which promotes healing of wounds. And we have some spectacular successes. The ultrasound is there are a couple of processes in healing of large, for example, diabetic wounds, where sometimes amputation is indicated. With our device, we prevented many amputations due to diabetic wounds. The way it works basically is the standard treatment for wound care is done, including cleaning the wound, what's called a negative pressure pump, which we also make, and applying antibiotics, but we also apply ultrasound. The ultrasound facilitates the effectiveness of the antibiotics and heals the wound faster. And okay, those are the main products that we have now and producing now and selling now.
Okay, so there's a lot there. I want to unwrap it a little bit, okay. But first, let's start with how did the company come to this point? Where did it start so that it could get to be where it is today?
Okay, the company was started about 8 years ago. The main office is in Nesher, Israel, which is a suburb of Haifa. By the way, Haifa is one of the fully integrated Arab-Israeli cities. There's virtually no terrorism there. It's very safe. It's like a normal city. The scientists who developed this technology came to us from previous laboratory and academic fields where they use this technology to do the same thing, but it was never commercialized. And the company has an Israeli. In Israel, we do all the R&D and the production. We have a company presence in Elmsford, New York, which is a U.S. It's NanoVibronix Inc, which is part of NanoVibronix Limited, which is the Israeli company. It's one company together, and we do the distribution and sales in the United States and in South America and Canada and the whole North American continent.
Okay, so I also want to talk about the technology a little bit behind the products that you're developing. Let's elaborate on that a little bit more because, you hear ultrasound for pain management. I mean, most people think of ultrasounds for when they're checking to see what the sex of the baby is potentially, So can you explain your technology and how you're applying it to the various markets you're going after?
Right. So we have what's called, for the pain management, we have wearable ultrasound. That means that the ultrasound driver is about half the size of a cell phone, and it's complete. It provides all the ultrasound to put through the ultrasound transducer. The ultrasound driver. One of the reasons why it's so effective, as I said, that ultrasound has traditionally been used therapeutically for pain management, but it only lasts as long as you apply it and within a few days after the application, and then the cycle of pain starts all over.
But how does that work? What does that mean?
Okay. So again, the way our ultrasound works is it repairs the myelin coating on the nerve, and that's why one usually has pain. Now, regular ultrasound doesn't repair it; it just makes it feel better. I'm talking about therapeutic ultrasound. So there's diagnostic ultrasound, as you said about imaging ultrasound, but this is not the same thing. The reason why our ultrasound is able to be effective in either in curing or either ameliorating pain on a long-term basis is because, in fact, the ultrasound is applied for in a 6-hour period. The driver goes 30 minutes on, 30 minutes off, etc., until for a period of 6 hours, constantly doing this repair function. The ultrasound driver is connected to a ultrasound transducer, which is in a adhesive patch. The patch is put again on the part of the body wherever the pain is, on the shoulder, on the elbow for abdominal pain, and it constantly supplies ultrasound to the nerve and heals the myelin coating. It also regenerates blood flow, and it helps heal tissues, and that's how it works.
So how big are these markets that you're going after currently?
Okay, so the market for pain is huge, and it's certainly in the billions of dollars. And there's specific markets. For example, a common side effect of stroke, which there are 500,000 people who survive stroke, and 500,000 in the United States. And those people also the 500,000 generally have residual shoulder pain, and that's a chronic problem after stroke. That's one market we go after. There's another market called trigeminal neuralgia, which is a horrible face pain. It's so horrible it's called the suicide disease because it's treated as many pains with opioids, and the pain is so bad that the opioids for trigeminal neuralgia, for example, make people feel like zombies, and some of them just don't want to live anymore. In fact, we have records of, for example, a 14-year-old girl who committed suicide because of this face pain. It's not uncommon, and there are a couple of other optional treatments for it, which are only 50% effective. Our device is 72% effective, which means it'll either cure it or reduce the pain to such a low level that the drugs would not affect someone's life. That's so that market is pretty substantial. And again, we have sports injury markets. So, for example, in sports injury, think how valuable it is for an athlete, even a professional or college athlete, if they could get back in the game one day earlier. And we've been effective for tendonitis, which is a very difficult type of pain to cure. And we've been effective for all kinds of joint pains and those kinds of injuries. That's one product. The second product, UroShield, there is something like 25 million catheters that are used in U.S. hospitals every year. Of those, about 15-20% become infected. Those that certainly after 7 days, it's almost guaranteed it'll be infected. This has a tremendous not only problem in healthcare, but an economic problem for hospitals, because you probably know that if a patient is treated in a hospital and in before 31 days they come back for a problem like an infection in a catheter or some other problem with what they were treated for, the hospital does not get reimbursed a dime. And if a person comes back with an infection in the blood from a catheter, you're talking about a very long hospital stay. That's a lot of money. So the third product, which is Wound Shield, has also a very in a very large market, also in the billions of dollars. The market has many different components to it, and we think that we have a product that can be effective, and we know it's effective in healing very, very difficult wounds like diabetic wounds.
So where's the company currently at with the FDA?
Okay. So we operate an international, we sell internationally all over the world. For the outside of the United States, we have the CE mark on all our products, on Wound Shield, Pain Shield, and UroShield. And with the FDA, we have two products that are cleared. One is Pain Shield is cleared for any type of pain, which is a broad, general, description of its safety and effectiveness. We also have our negative pressure pump for wound care, which is one half of the component of wound care, which is cleared by the FDA. We are doing right now clinical studies we have clinical studies in Europe, but the FDA likes to see clinical studies in the United States. We're doing a clinical study in New Jersey on post-prostatectomy. That means people who have had prostate operations, men all the time, and of infections in catheters. They leave the hospital with a catheter, and it often is painful, and it might get infected. So we're doing a clinical trial for that situation. Once we have that clinical trial done, we expect to apply to the FDA for clearance. We have a lot of predicate devices for that, especially Pain Shield we use as a predicate device, and I think we can get clearance between 90 to, at the worst, 6 months. And once we have that, we'll have a big push on that product in the United States. For Wound Shield, we haven't done anything with Wound Shield in terms of the FDA because we're looking for a partner. The Wound Shield market is really dominated by a few very large companies. It would be very difficult for us to match that domination, and so we're looking for right now actively for a partner. Once we have a partner for that product, we have some interest in that. We will apply to the FDA for clearance.
And are any of these products the ones that are cleared in the U.S.? Are they reimbursable as well?
That's an excellent question, and the answer is yes and no. And I'll tell you what I mean by that. We were inspected by Medicare. That's the standard. We passed the inspection, and the reimbursement was $8, which is no reimbursement. And it was based on the current reimbursement for in-the-office ultrasound. But it's a very bureaucratic organization, so we can't, it's like fighting City Hall. It's not worthwhile. So what we did as an alternative to that is to find customers and markets which are independent of insurance. For example, the whole sports market the sports market, you can take the NFL, for example. I mean, they have their own insurance. It has nothing to do with Medicare or insurance reimbursement. If they happen to see a device which works, they buy it. There's another very interesting market, even larger than that, also related to the NFL. The NFL puts money to all its retired football players into a health savings plan. It's a significant amount of money. Almost every single NFL retired football player has enormous muscle pains, joint pains, even forgetting about residual problems with concussion, which is another thing. We don't do anything with concussion. So that's a market that we're tapping. And that also goes into all kinds of retired players in college teams, professional tennis, professional basketball, everything. So that's the market we're targeting. In fact, we're targeting trainers for all these teams, and we're going to conferences where these trainers come and look at products. So that's how we're. And we've also targeted middle class and above consumers who have these types of pains, and they just pay privately, and we sell a fair amount of these devices privately with no reimbursement. And by the way, there's one more aspect to all our devices which is interesting. There's a disposable. The disposable is the ultrasound transducer. For example, on the UroShield, for every time the catheter is removed, the transducer is thrown away. A new transducer is about $30. The patch-based products like Pain Shield and Wound Shield, it's the same thing. After about 7 days of use for Pain Shield, the ultrasound transducer is thrown away, and one must get a new one. It's another $38, and the same thing for Wound Shield. So it has a disposable market. I call it the gift that keeps on giving, and at least for the company and the device itself.
Bill, we're in the middle of 2016, first quarter 2016. So from what you can tell me, moving ahead, what are some of the goals and milestones for the company?
Okay. What we're trying to do is we're trying to focus the company on where reimbursement is not an issue. As I explained before, the sports market, but we have two exciting new products which are coming out, and one is called New Skin Shield, Renew Skin Shield. Renew Skin Shield is a device for facial rejuvenation for women. Men can use it too. It increases the collagen. It's like a woman's headband that they wear for hair, but on the tips of it, which placed here, are two ultrasound transducers. The driver and everything, the battery are in the headband. It's aesthetically designed so it looks nice. The woman, some men can do it too, wear it. You wear it for a couple of hours every day. It will provide the same level of facial rejuvenation as retinol A. We've done in vitro testing on this on human skin and proved that this works. It works by increasing the collagen, increasing blood flow. So a woman who has skin of an older woman, the facial skin will be rejuvenated to that of a much younger woman. It's a great product. We already have an infomercial company which does about $150 million in sales who's interested in private labeling it. So we see this as an enormous market. And again, we don't have the resources to market this ourselves, so we're going to partner with a company which does. The last product I want to talk about, which is very exciting for us, has even a bigger market than the UroShield, is called Trach Shield. You might be familiar with tracheotomy, where they put an endotracheal tube through the person's mouth to help them breathe. Some of the people are conscious, some are unconscious. The ones who both share the same problem of infection. It's guaranteed. It's not a question of if, it's only a question of when. After several days or a week, the tube gets infected. We have a version of the UroShield that clips onto the tube, and we know that it will prevent infection, and also that it will reduce pain for the conscious patients. I want to mention that, as I told you, we want to go after where reimbursement is not an issue. For the endotracheal tube, it's such a huge problem in hospital. By the way, there are 50 million of these tubes that are inserted every year in U.S. hospitals, forgetting about what's going on worldwide. And the UroShield and the Trach Shield, the endotracheal tube, can be bought by the hospitals without thought of reimbursement, although they would like reimbursement, but they would be so essential to the treatment of the patient that it would be like buying sutures or something like that. They will just buy it and pay for it and not worry about the reimbursement. Well, they'd like to get reimbursed, and maybe in the future that would be in the cards. But for us in our marketing and selling, that wouldn't be an issue.
Bill, for our audience, where can they go and find more information about the company?
Okay, the best place is NanoVibronix.com, NanoVibronix.com, where you'll find about everything about our products and all the clinical trials, patient testimonies, and every aspect of it, how it works.
My name is Robert Kraft, and I'm coming to you live on SNNLive, and we're here at the SeeThruEquity and the Brewer Group's second annual Innovations Investor Conference 2016 in Miami, Florida. With me again has been Dr. Bill Stern from NanoVibronix. The symbol again is NAOV. Dr. Stern, thank you so much.
Thank you. It was great speaking with you.